The new CDC panel that advises on vaccines is meeting today for the first time. Earlier this month, Health and Human Services Secretary Robert F. Kennedy Jr. let go all 17 previous experts on the board and replace them with his own picks. This advisory group will look into current shot schedules and advise physicians on what to do. The thing is, those advisories could mean which vaccine insurers will and will not pay for. With me is Scripps News investigative correspondent Patrick Terpstra. And Patrick, on the agenda today is COVID, the RSV vaccine. The concern a leader of an anti-vaccine group is in the panel. How is it all playing out?
Well, Andrew, in the morning we saw a focus right away on the safety and effectiveness of vaccines. This committee announcing that it will study the effects over time, the cumulative effects of childhood and adolescent vaccines, and that they also may have their work groups reevaluate the immunization schedule for measles and hepatitis B. Hepatitis B being a vaccine given to babies. This panel making these decisions despite objections from many in the medical field. A CDC panel of vaccine advisors appointed by HHS Secretary Robert F. Kennedy Jr. began a two-day meeting that could affect immunization availability for a number of diseases. The new members of the Advisory Committee on Immunization Practices includes physicians, academics, and critics of COVID-19 vaccines and lockdowns.
The 17 members that were fired were all very well-respected experts in this field. The people they replaced them with most of them are not.
Dr. Fiona Havers is a former CDC official involved in COVID-19 tracking who resigned from her position in protest of Kennedy's shakeup of the panel. She worries votes by the new members could make it harder to find immunizations.
If people are sitting on this committee, start restricting vaccines and say that and recommend that they are no longer given to certain groups of people, people will not be able to get these vaccines and more people are going to die.
The group will discuss the effectiveness of COVID, RSV, and MMRV vaccines and discuss the flu immunization for the fall. New committee chairman Dr. Martin Kulldorff tried to reassure skeptics of the new appointees.
If you wish to know which vaccines are suitable for you and your children and at what ages, then we will provide you with evidence-based recommendations.
But that pledge has not stopped criticism. Republican Senator Bill Cassidy leads the Senate Health Committee and called for the meeting to be delayed until the panel is fully staffed with more robust and balanced representation. And potential future guidance from the advisory panel could impact both the availability of vaccines and what we pay for them. Medicare and most insurers are required to fully pay for vaccines recommended by the advisory panel. If recommendations are changed, Americans may have to pay out of pocket for some vaccines in the future. Andrew.
And Patrick, physicians look to this panel for making those recommendations to patients. Is it just about the money, or is it about actually what shots would potentially be available to patients?
Well, it certainly is about both. And these recommendations historically from this panel have really been a big deal. Today, the American Academy of Pediatrics came out and said, because of concerns with the makeup of this particular panel and the firing of all those old members that we've been talking about, the Academy will publish its own vaccine schedule developed by experts. But those are suggestions, they are recommendations, and they would not necessarily be covered by insurance. So, Andrew, in the weeks, in the months to come, we're going to have to see how this plays out. Will insurance companies, will Medicare still pay for these vaccines, and will they still be as readily available as they have been in the past?
All right, Patrick Terpstra in our D.C. newsroom. Patrick, thank you.